Okay, next guy I want to talk to you about is this guy right here, Martin Pall. He's actually the author of this book right here called Explaining Unexplained Illness. And what I think is funny about it is, you want to talk about an autistic genius, this is the guy. He's a biochemistry professor, and he also knows a lot of engineering and physics. And he spent a long time reading through all the oxidative stress pathways, and he came up with what is called the no theory, which means nitric oxide peroxynitrite. All right, and I do think he's right about a lot of stuff. And what he basically says is, once the cell gets going into advanced phases of destruction, you create vicious cycles whereby it just keeps getting worse and worse until the cell is destroyed. And he's right, okay? So one of the things he points out is that people are being exposed to a lot more EMF than ever before, and that allows calcium into a cell, because EMF, like if you hold your cell phone to your brain, it's a low-power microwave transmitter, and that opens up voltage-gated calcium channels on your plasma cell membrane, allowing calcium from the extracellular space to go into the cytoplasm, the main open area of a cell. The calcium concentration in the extracellular space is about 10,000 times higher than it is inside the cell. Because remember, cells were first made by God in the ocean, in seawater. So the extracellular space is salt, sodium chloride, and it's calcium, like limestone, rinsing the calcium carbonate off by the water, the waves, splashing against the rocks. Okay, so I just tell you that because what he's saying is cells are being destroyed because of too much EMF from people sitting on their cell phone all the time. Okay? Now, he goes into a lot more pathways than that. He talks about other things that can increase cytoplasm calcium. All right? But he then takes it further down the road, and he starts talking about how there's a cascade of reactions that'll happen that'll increase intracellular nitric oxide in your neurons, and you don't want that. Everybody knows nitric oxide is a good thing in your arteries. It causes vasodilation of vascular smooth muscle cells. It causes an antiplatelet effect in your arteries to prevent clotting. That's all good. But that's produced by eNOS, E for endothelial, NOS, nitric oxide synthase. But there's another type of nitric oxide. That's produced in the brain by microglial cells, inflammatory cells, and that's produced by a different enzyme called iNOS, inducible nitric oxide synthase. And when it makes nitric oxide, it makes it for, minutes and hours, whereas, endothelial cells, just, microseconds, little flash of nitric oxide in small amounts. iNOS makes tons of it, and then it can become like a free radical and it can be damaging. So, anyways, what he's saying here, and why am I including him in this talk on Parkinson, he believes this is contributing to Parkinson's disease, because what's happening is you're losing 60% or more of your neurons in the substantia nigra, your dopamine-producing neurons. You only have about 400,000 of them. And so once you hit that, like you only got 40% left, it kind of like kidney failure. You want to save every nephron in the kidney so you're not screwed on dialysis. And what he's saying too, and I agree, is that this process of vicious cycles is at risk to damage more and more neurons and lose more and more of your dopamine brain cells. And he thinks that this is contributing to it in a significant way. And he thinks it's also contributing in a significant way to causing Alzheimer's disease, Alzheimer's dementia, as well as ALS, amyotrophic lateral sclerosis, Lou Gehrig's disease. And he believes it's also contributing in the heart to congestive heart failure. Okay, and you know what? He's probably right on all of these things. Okay. One of the things, though, I think a little bit problematic with him, he doesn't know nutrition, so he thinks the Mediterranean diet's a good diet. That's what people always say when they haven't really studied it. Because actually congestive heart failure has been reversed by a low-fat vegan diet. There's case reports on that, several. Baxter Montgomery had written some of those case reports. Robert Osfeld, the cardiologist out of Montefiore, wrote a bunch of those case reports. Kempner was showing reversal of congestive heart failure back in the old days with his low-fat vegan diet. So anyways, though, Martin Pall's a brilliant guy, and what I mean by autistic genius, he's got a dynamic emotional range about this big. Mine's about this big, okay? And people call me autistic, okay? Wait till you watch his lectures. And here's his book. It's like about, how many pages? 430 pages of small print biochemistry, like with almost no pictures. There might be, like, if you look really hard, he maybe has a few illustrations in there, hardly anything. So it was a challenge to read, but it was also a pleasure to read because it's so brilliant, and it is. And he's got videos on the internet that you can watch and learn a lot from him. I do think the guy's a true genius. I'm not kidding. I've actually spoken to him. I'm very impressed by what I've read of his books. I've read his papers, and I've spoken to him. He is a brilliant guy. He really is a genius, that guy. Okay, And he's a biochemistry professor too. All right, so what am I getting at? What's the answer to Parkinson's? I got a lot more slides here, but I'm just going to give you the general purpose here. There's a pathologist out of Germany named Heiko Brack. I think it was like around 2003. He figured out people were getting Parkinson's from their gut. And he knew you could get polioenterovirus from your gut. And he thinks it's traveling up the vagus nerve to the brain. Okay, so that would be like speak no evil. It would be eat no evil. Don't eat stuff that's going to have mitochondrial toxins in it. Gee, all processed foods practically have fungal inhibitors in them that are mitochondrial inhibitors, like typically succinate dehydrogenase complex 2. All right, drink no evil. That means filter your water, because otherwise you're going to be ingesting atrazine, glyphosate, and a whole bunch of other bad stuff, and estrogenic chemicals, mitochondrial inhibitors, toxic things, fluoride, aluminum, etc. Okay, drink no evil. And then the next one would be hear no evil, and that's a little bit of an indirect one. Don't hold your cell phone up to your, use your speakerphone, okay? So you don't EMF your brain as much, okay? Let's see, what else? See no evil. That one would be avoid stuff that stresses you out unnecessarily. You know, some stress in life you got to deal with it. Some stress you need just to have energy. But excessive stress for unknown reasons is bad for you. So like, don't watch or be around people that stress you out for no reason. Some stuff you got to endure, but don't overdo it. Because then when you overdo it, you activate this like excitotoxin pathway in a sense by increasing glutamate release at your brain neurotransmitters when you're stressed out. That's part of the whole fight or flight system of sympathetic autonomic nervous system. Okay, the next one is inhale no evil. This one, I think it was like Danish doc, something like Berghammer or something, figured out that there's actually a second pathway of acquiring Parkinson's disease through inhalation of toxic chemicals. And this can be, air pollution, so you don't be inhaling all the car smoke around you. When a big bus or a truck goes by, hold your breath till they go by. And there's other types of inhaled chemical, like we just talked about, TCE, trichloroethylene, PCE, perchloroethylene. Stay away from dry cleaners. Stay away from anything next to a dry cleaner. This is all stuff that over time you can gradually accumulate these toxins. And don't get me wrong, it'll take years to have that effect, but don't make a habit of it. Avoid these things, When you drive past the farmer fields, close your windows, put the no circulate air from outside into your car. These are all things you can do to minimize your risk of getting Parkinson's. And if you have Parkinson's, to slow down the loss of those neurons in your substantia nigra so you'll have better function for a longer amount of time. Okay, Parkinson's disease, where does it come from? It's first described in 1817 in England. England was the leading country of the Industrial Revolution. The Industrial Revolution, which, by the way, only happened in Europe. It only happened with white Christian males, and everybody wants to genocide all the white Christian males, but they're the ones who invented the modern world. England led the way with the Industrial Revolution, okay, starting in the 1700s and on to modern times, okay? USA kind of got going about 1840 with it, but the big competitors in England were Germany, France, and Italy. Okay, those were the most industrialized countries. My father's from Ireland, but Ireland's a poor, backward-ass country. The English basically owned the Irish like almost as slaves, or actually as slaves for about 1,000 years. Okay, my father, my grandparents, and my uncles, they all told me all these stories. An Irishman was not allowed to own a horse. The Irish Catholics were not allowed to have a school. They had hedgerow schools. They would educate them out in the fields. They would teach them stuff about, Catholic religion and all that stuff, and Irish history and the Gaelic language and stuff. Okay, so anyways, what I'm trying to say is that's where civilization came from. I've given previous lectures on that. Anybody who reads about it will know that, okay? And people say, well, China discovered this or that. And China did have pretty advanced metallurgy. It did come up with gunpowder. It did come up with some things. But the rulers, the mandarins, they wouldn't allow them to develop it. So nothing grew out of there. All the sea explorers were from Europe, like the Portuguese and like Columbus from Spain. But, China actually had brilliant sailors. They had a guy named Cheng Ho, okay? And it was around 1500 as well. But the mandarins, instead of letting the guy go sail across into the New World, they said, no, we must stop this. And they destroyed all his boats. And then they historically sort of hid him from the public so nobody could know about him. That's how they treat their inventors. Okay, that's why nothing really got developed by them. Okay, Peripheral arterial disease associated with substantia nigra, loss of dopamine neurons that communicate with the striatum. Okay, that's a fancy way of saying you lose those neurons from the substantia nigra, the dopamine-producing neurons. And it's not genetic, okay? Genetics don't change as fast. The incidence is going up through the roof compared to the past. And it just starts in these industrialized areas. So it started, we think of it as an industrialized thing from, London, where it's like described, but it then spread out to the farms when they started using synthetic pesticides and herbicides. The global distribution kind of mimics autoimmune disease, northern industrialized societies, because those are the ones that have all the air pollution, and those are the ones also that have so much synthetic pesticides. But the synthetic pesticides are getting to the third world countries as well. Let's see what here. Here's the guy I told you about, Heiko Brock. You get these Lewy bodies. You can see with a microscope on pathology evaluation of the brain, and they're described by Oken and Dorsey as being a garbage bag full of this protein called alpha-synuclein that's misfolded. Protein misfolding is a big part of a lot of brain diseases. Prion diseases are like the misfolded brain. You've heard me talk about that, going from alpha helix to beta pleated sheet. Alpha helix doesn't stack. Beta pleated sheet are flat like a deck of playing cards, and they stack up like a deck of playing cards. They aggregate. They're too big of a molecular weight in aqueous solution, the plasma, which is like water, so they precipitate, become insoluble. That's bad. Okay, when it spreads from the gut, you can start out by having constipation for a long time. It goes up the vagus nerve. You cut the vagus nerve, you have a lower incidence of Parkinson's disease. John Hopkins found they could inject alpha-synuclein into the gut wall, and it'll cause this mechanism. It'll propagate like a prion, aggregating and getting bigger and pushing out things. There are other people like, I think his name is Alberto Espay or something. Here he is, Alberto Espay, world famous Parkinson's expert. And he says, oh, no. This whole Brock theory is overrated. So it's always a little hard to know what the truth is, but it does seem that there are these two mechanisms. Okay, I don't know, the exact detail of it, and most people support it. I read a whole bunch of papers supporting it, and then I see somebody like Alberto Espay, who's a legitimate expert, and he's not such a big fan of it. But be that as it may, and then we talked about Borghammer and the olfactory tract, going to the brain first. So this is nose to brain, right up to the olfactory tract. And this is gut to vagus nerve to brain. The bottom line is for any disease, you want to know what causes it, and you want to avoid the thing that causes it, okay? Problems with Parkinson's pathology diagnosis. Let's see here. Albert Espay, here he is. He says that the proteinopathy concept is highly overrated. So he's not even sure the alpha-synuclein is a causative event. What he's saying is, if you always see a fireman at a fire, does that mean the fireman caused the fire? Is the alpha-synuclein Lewy bodies really the causative thing, or is it more like a tombstone showing where the neurons were dead by Parkinson's disease from something else that killed them? Okay, and I don't know that answer to that question for certain. I don't think anybody does. Here he is, world-famous expert, studied it all his life, and he doesn't know the answer to that question. But we do know things that causes it that you would want to avoid. And then the other little thing that they don't tell you about too much is a lot of these brains, they will have not just Lewy bodies, the characteristic finding of Parkinson's, but they'll also have the characteristic findings of Alzheimer's. They'll have the extracellular senile plaques with the amyloid, the beta amyloid plaques. They'll have the intracellular neurofibrillary tangles with the tau protein. And they don't even talk yet that a lot of times those are associated like with aluminum and some other heavy metals, and even potentially an infection. Okay, it gets a little complicated. I'm not that big a fan of the infection theories. I know the infection theories for all these diseases, and I'll tell you why I'm not that big a fan. Because I look at their brains on MRI. An infection, if it's progressing, you have a lot of liquid edema, swelling, and I don't see that. I see it looking pretty much the same one year to the next, okay? So there certainly ain't no rapidly progressing infection. Because I have read the papers about guys saying, oh, it's an infection. I don't think so. Okay, normal people also have Lewy bodies at autopsy. Non-demented people will often have more beta amyloid protein plaques at autopsy. The so-called cognitive reserve theory from the Notre Dame nun study in Mankato, Minnesota, showed that the nuns that were more scholarly, they would live longer and not have dementia, but they would have lots and lots of senile plaques, so-called Alzheimer's lesions, and what they said was, well, they have cognitive reserve. The reason they're not demented is because their neurons function at a higher level, so despite losing a lot of neurons and having all these plaques, their cognitive reserve enabled them to not become demented. So there's other people like Jack Delatory, the guy who's got Delatory's theory of hypoperfusion, the guy who tied off the carotid artery in the mice. I call them mouse equivalents and all the stuff that's similar to it. And I actually think he's right, because what do I see in all these demented brains? I see a shrunken atrophic brain, a perfect fit with what Delatory's talking about. And it goes with everything else I see in dementia. All right, so anyways, but getting back to this, and why am I going through all this? Why am I telling you that the patients don't tend to have just one disease or just one pattern? Because what I'm kind of saying here is it's a little bit all the same pattern. Things that destroy the brain, destroy brain cells, and if they get these substantia nigra cells, you get Parkinson's. If they just get a diffuse destruction, you get dementia. Okay, and these Parkinson's patients end up with dementia. They often call it Lewy bodies dementia. Okay, 80% of them have the beta amyloid plaques, like an Alzheimer's, so-called Alzheimer's would have. Okay. All right, and the so-called Alzheimer's diagnosis is not even that reliable at autopsy. So I'm telling you, the whole thing's overrated. I think, familial genetic Alzheimer's is real, but I think the so-called sporadic, non-genetic Alzheimer's is largely BS. That's a whole other topic. I've given lectures on it, but I'm letting you know, like, where am I going? Where am I going with this whole talk? What I'm trying to say is, if you have Parkinson's, if you want to prevent Parkinson's, the smart move is avoid everything that destroys brain cells. Then you'll have the best possible brain you could have. They don't think like that in medicine because it doesn't involve selling a drug or doing a surgery. Medicine's all about selling drugs and doing surgeries. Okay, so we know some of these things. We know dairy's bad. The galactose is toxic. The pesticide residues are toxic. Substantia nigra dopamine cells have glucose type 4 transporters, suggesting that they're probably vulnerable to diabetes-related insulin resistance and can lose brain cells because of that. That's a big thing, so you want to eat a low-fat diet, okay? Having glucose type 4 transporters, they're vulnerable to starving in the midst of plenty, okay? They can't burn fat that well, so you don't want them to be deprived by insulin resistance of glucose. Well, I've given separate lectures about how that can destroy brain cells. Iron accumulation causes oxidative stress, and that can lead to problems in your mitochondria. Can actually sort of complement the no-oh-no pathway of Martin Pall. We talked about some of these mitochondrial toxins. Michael Fox was diagnosed with Parkinson's when he was only 29 years old. And what that means is he's too young to have significant atherosclerosis. So it ain't atherosclerosis. And there's a lot of people that are diagnosed young. They call below 50 years of age being young Parkinson's. There's a lot of them. Don't get me wrong, it's more common in old people, but there's enough young people. It ain't atherosclerosis. It certainly ain't a primary mechanism being atherosclerosis, because none of these young people will get it. Usually when I look at a young brain, patient less than 40, their brain's clean. There's usually zero little strokes. Whereas when most Americans after 55, they got a couple of small strokes, especially the men. Let's see, always filter your water, at least with a carbon filter. I'm going to get into more detail here. I like Pamela Quinn and her lectures on exercise for Parkinson patients. That's good for them. Parkinson's exercise can promote neurogenesis. And, it's not going to produce a lot of neurogenesis, formation of new neurons, but having some is better than none. Okay. Okay, neurogenesis and Parkinson's disease. By the way, these Parkinson's neurons are giant because even though they look like a little tiny thing in the substantia nigra of the midbrain, they send out branches all over the place to the brain. They modulate neurotransmission all over the brain. So they can end up have 13 feet long of axons, okay? And according to Alberto Espe, he says they can have 2 million mitochondria in a single dopamine neuron from the substantia nigra. Other people dispute that. Other ones say, no, it's only thousands of them. Okay, but it's still lots of mitochondria. So what am I saying is, if that cell is dependent on having thousands or even millions of mitochondria, how well do you think it's going to tolerate mitochondrial inhibitors? How well do you think it's going to tolerate the typical fact that the average American is exposed daily to 5 or more mitochondrial inhibitors? Think about it. How many patients are on metformin, statins, beta blockers? They're eating processed food with atrazine sprayed on their corn. They're drinking out of a BPA bottle. They got tap water with fluoride in it, tap water with aluminum in it. Tons of people, tons of them, many millions. Okay. All right, so these cells are going to be sensitive to mitochondrial inhibitors. Okay, and then also they're getting hypoxic. You don't have enough oxygen going because there's a baseline atherosclerosis all over the place from hypertension and diabetes, the gateway diseases, which almost all patients have in the West after middle age, and that's causing atherosclerosis in their brain, and that's dropping their oxygen production. So the poor mitochondria are screwed. Minimum 7 or more, well, I wouldn't say minimum, routinely 7 or more mitochondrial inhibitors on board, damaging their mitochondria. Then they got mercury from their amalgams in their teeth, floating back up into their brain, damaging their mitochondria. They're drinking tap water with all that crap in it. damaging their mitochondria. It's not good. And then they got hypoxia from their atherosclerosis. Not good. Rough life for the poor substantia nigra dopamine neurons. Okay. Let's see here. Let's go to the next slide. Oh, levodopa. Levodopa, you know, it has to go from the periphery and get up into the brain. You can give carbidopa to block the wastage of it in the periphery. Okay. In the periphery, this enzyme, L-amino acid decarboxylase, LAAD, will convert it into dopamine in the CNS in the periphery. You want more of it to go into the brain. If you eat too much dietary protein, that also can block the dopa transporter. So here's an example of an article to that effect. Protein-restricted diets for Parkinson's disease. And they'll talk about protein-restricted diets are an effective approach to improve motor fluctuations in Parkinson's patients. Basically, more levodopa gets into the brain if you eat a low-protein diet. All right, I think that's it for this part 3 of Parkinson's disease in 2025. I'll do part 4 in just a little bit here. Hope you found that helpful.